Welcome to all our viewers to this ISHRS and BAHRS, that's the International Society of Hair Restoration Surgery, and the British Association of Hair Restoration Surgery live stream, looking at the UK's, what patients in the UK should know about when they're having hair transplant surgery. I'd like to invite our panel to give their thoughts, and hopefully at the end of this, patients will have an idea of where to get reliable information and seek ethical surgeons and what they should know about hair transplant surgery. So first of all, I'd like to welcome Dr. Bonaros, who's a hair transplant surgeon in Scotland.
Hello, Craig. I'm very glad to be here. Thank you.
I'd like to welcome Harry Wallop, who's an investigational journalist and broadcaster in the UK.
Hello, everyone.
And I'd like to welcome Dr. Bessam Farjo, who's a past president of both the International Society of Hair Restoration Surgery and the British Association of Hair Restoration Surgery.
Thanks, Greg. Thanks for the invitation.
And last but not least, Dr. D'Souza, who is the current president of the British Association of Hair Restoration Surgery.
Hi, thanks, Greg, for the invite.
So the ISHRS has a campaign called Fight the Fight, which stands for Fighting Fraudulent and Illicit Global Hair Transplant Surgery. And the idea here is that we know there's a lot of poor quality and unethical hair transplant surgery that goes on all over the world, but also in the UK. And this campaign's been going for about 2 years. And for me, the definition of the black market or black market surgery is really anything that deceives the patient. And we're going to cover that later on during this live stream. But first of all, Dr. Farjo, can I ask you to tell us briefly the range of things that hair transplant surgery can be used for, and perhaps a little bit in your experience, what are the benefits to patients?
Thanks, Greg. So hair transplant surgery perhaps should be better known as hair restoration surgery, because that's what it's about. It's about restoring hair where hair doesn't exist or hair existed before and it's not there anymore. So the most common condition is the genetic or the hormonal type hair loss, whether it's male pattern hair loss or female pattern hair loss, to transfer hairs from hair where it exists plenty, is not meant to fall out, and replacing the areas where it's bolded from. But we can also use it to restore hair elsewhere or for other reasons, like for burns, accidents, or lowering someone's hairline, or where people lose hair from other places like eyebrows, face, eyelashes even. But the bottom line is that we use it to restore hair where it upsets the patient, gives them great emotional and psychological issues. And we see it all the time, restoring hair where it's gone, improves their livelihood and their self-esteem enormously.
Yeah, so you've mentioned quite a lot of causes of hair loss and indications for hair transplant surgery, and clearly some of them, the ones for scars and perhaps for transgender patients, and maybe for some dermatological conditions, can be considered quite obviously as reconstructive or restorative. But would you consider hair restoration surgery for male and female genetic hair loss to be cosmetic or medical?
So that's an interesting comment, Greg. Depends on a definition of cosmetic, but the general impression of cosmetic kind of tends to trivialize things and gives the impression is somebody just doesn't like a particular look. So cosmetic, yes, it's changing an appearance, but the purpose of it is definitely not cosmetic. It's medical, because we are restoring a feature that one had before and then they lost it, and losing that feature causes a variety of effects. Like I said before, emotional or psychological. So as far as I'm concerned, as far as we're all concerned, it is a medical procedure done for a medical purpose. Now, there are certain conditions where maybe you can consider cosmetic, where you restore hair or you implant hair where hair didn't exist before, like bringing someone's hairline down where it genetically was high up, or redesign someone's beard, for example. But these are pretty unusual requests. The vast majority of our cases are definitely of the medical variety.
Okay, so we've kind of set the scene there on what hair transplant surgery can be used for and the indications for it. So let me ask Dr. D'Souza, what should patients in the UK be aware of when considering having hair transplant surgery? What are the sort of public awareness messages as the president of the British Association of Hair Restoration Surgery that you'd like to get across?
Thanks, Greg. So, I mean, there's a lot to it when you're trying to find a provider. There's a lot to it, but the BAHRS essentially has 4 public awareness sort of points, which would be good to sort of go over. The first is that when you're looking for a clinic, they should be listing all of their surgeons on the website, including their biography, their credentials. It's really important for patients to have an idea about who's actually going to be operating on them. Unfortunately, there's a lot of websites out there where they aren't listing the surgeons, and unfortunately, in the UK, there seems to be an increasing number of clinics which are acting as sort of brokers or middlemen, where they're really, sort of not really treating these patients properly. The second would be also, if you're, once you're at the consultation, there should really be a surgeon present deciding on, first of all, what technique is most appropriate for you. So there's 2 general techniques: follicular unit excisions, FUE, and then linear strip excision, or FUT. And these decisions have to be made by a medical professional and your operating surgeon. That would also include things such as graft numbers, design of the hairline, all of really important stuff that you need to really nail down and discuss with your surgeon before going any further. Third, really is one of the BAHRS' main messages, that surgeons should be performing the surgery. So follicular unit excision is the surgical, or one of the surgical steps, and it's vital that patients really get it in, make it very clear to the clinic which they're proceeding with, that the surgeon will be doing the surgery. And the last thing is that, you should be checking whether or not these clinics are actually registered. So the Care Quality Commission, the CQC, every clinic in the UK who's offering hair transplant surgery should be registered with them. And in Scotland, Wales, Northern Ireland, the respective bodies.
Yeah, just to clarify that, in England, clinics need to be registered with the CQC, but in the devolved nations with the equivalent regulatory bodies. So, Dr. D'Souza, if patients want to get some advice when they're considering hair transplant surgery in the UK or overseas, is there anywhere they can go to get that sort of advice? Any website links that you can point them to?
Yeah, I mean, absolutely. I mean, the BAHRS has 2 great documents on the advice section on the website. It lists a lot of things which I think patients will find very useful to have a look through. So one of those documents is advice on choosing a hair transplant provider in the UK. And then there's another document which actually poses some questions to ask themselves if they are looking for surgery overseas.
Okay, well, that leads us nicely into my next question, which is directed to Harry. Harry, you're an investigational journalist, and you did a really interesting piece where you actually went to Turkey posing as a patient. Can you tell us a little bit about why you decided to do that and what your experience was?
Yeah, so this was in 2020, so it was 3 years ago. It was just before lockdown, and it was I worked for all sorts of newspapers, magazines, broadcasters, and in fact just a Daily Mail editor, I think no more sophisticated than had come back from holiday in Turkey and had seen an alarmingly large number of men with these very distinctive bandages, and found out this was hair transplants. And they said to me, because obviously you can see I am the perfect man to go, would you investigate this? What's this all about? Why are there so many men going to Turkey to get hair transplants? Why are they going to Turkey? And after a little bit, I said, well, to do it properly, I should probably go myself. It's going to be very hard to speak to people, British people who've had hair transplants, unless we maybe go out there ourselves. And then we discussed maybe I should go undercover. And I've done undercover stuff before. It sounds very fancy. It's not really. It just means I'm going to do it as a patient. No one knows who I am in Turkey, so there's no difficulty. So I decided to pose as a patient, as someone who is very interested in having a hair transplant. And the idea was I would go to a couple of clinics. I've signed up with a couple of clinics, and I would back out at the last possible moment. I mean, gosh, maybe if I was offered a fantastic hair transplant, maybe I wouldn't have backed out. But that was the idea, and I went with a photographer who just posed as a friend and was able to take some photographs on my on a camera phone, which of course is now broadcast quality. What was interesting was it was so much of it was all done before I even left the UK. So I literally just Googled hair transplant, and the first thing that came up was essentially deals in Turkey. Even though I'm sure Google must know my location, it was deals in Turkey, and the thing that was being sold most was the package. So hair transplant, 4 nights, VIP hotel, VIP transfer, and it was all done as a complete package. And the hair bit seemed to be in some ways less important than the hotel and the transport and all that. And it was all done by WhatsApp. So I was asked, I contacted lots of people. So I did choose 2, but I contacted lots of different clinics. And indeed, a lot of them weren't the clinics themselves. To your earlier point, they were sort of middlemen acting for various clinics, sort of travel companies, medical travel companies. And they asked me all to basically take photos of my head from different angles. And then they would calculate how many grafts I was going to have. And they would come back, a day later with my head mapped out. And I was being offered, at one point, I think I was offered 7,000 grafts on my head. Now, of course, I don't know anything. I'm an ordinary patient. I, in fact, have done my homework. I've spoken to various experts, and I know that's an alarmingly large number. I think actually the 7,000, after they'd seen my photos, they reduced it down to maybe 5,000, 4,500, but all in one sitting. So I then booked a couple of packages, incredibly cheap in the grand scheme of things. The cheapest one was £1,400, maybe £1,500 for flights, hotel transfers, and the actual hair transplant. I mean, that's the cost of 2 nights in an extremely flash hotel in Istanbul, and that's what they were offering me. So I went out there, and of course, what you're doing is, what was the fascinating experience, you don't actually have any real time with the doctor. You have a patient coordinator either on the end of a phone or at the clinic, nearly always on the end of a phone. You get taken to the clinic, and you go, in both cases, they're slightly different. One was slightly smarter than the other. But you go in and you do finally meet the doctor essentially 20 minutes before you're due to have the operation.
So that was one of my questions was, did you, when you were there, did you have a sense of trust in that this was a medical procedure, that you were going to be well looked after as a patient, that you weren't just a client or a customer? Did you have any idea who was actually going to do the surgery?
No, not really. I mean, the 2 clinics were slightly different experiences, and one was definitely a bit more professional medically. I had blood tests done the night before, and I actually know that's quite reassuring that they're checking that I'm fit and healthy, and I'm okay to do an operation. The other one, no, it was very much, I was being booked into a hotel. I had a taxi. Well, I mean, this never made it into the piece. When I arrived in Istanbul, I think they told me to WhatsApp when I arrived, and someone would pick me up. And I get a message back going, "Can you get me a carton of 200 cigarettes from duty free?" And this is my first interaction with the essentially my medical patient coordinator. "Can you get me discount cigarettes?" I mean, it made me laugh, and I said, "I'm not sure. Am I allowed to do this?" And there was a big consult. Basically, I was letting him down if I didn't get him the discount cigarettes. That was far more important than me booking into the clinic the next day. No, I had. So in that one, which was quite a down market, that was the cheapest one. No, I had the doctor, when I finally met him, actually, he was quite good. He did answer all my questions. And because English? In not great English. And a lot of
the staff, did the rest of the staff speak it? Did you get an impression you would be communicated with during the surgery in English?
Well, yeah, in broken English. And there was a lot of, I was going, they were promising 100% guaranteed or 99% guaranteed. They're offering various things like lifetime guarantee, 99% successful, and pain-free.
Yeah.
completely pain-free. And because I was in my journalist mode, I was sort of asking lots of follow-up questions. Are you sure? Because I was recording it secretly. I did want to make sure I had it, that I wasn't being unfair to them. And he answered questions, and it was only when I really pushed him, I said, pain-free, is it really possible? Is it really possible to be pain-free? Went, oh, well, okay, we do have to inject you first. That might hurt a little bit, but then it will numb you. It's like, okay, well, then that's not pain-free, is it? That's one, we're dancing on a pinhead here. So,
okay, well,
no,
I
would not have been happy is the answer.
Okay, well, that was kind of the bottom line is would you have proceeded? But let's move on to Dr. Bonaros, because you run a fantastically ethical, very high quality practice at the moment in Scotland. But I think previously, once upon a time, you worked for a clinic in the UK that perhaps you thought wasn't as ethical as you would have liked. Do you want to tell us just a little bit about the sort of pressures you were put under by the management as a doctor working there?
Yes, Craig. I'd love to. Thank you very much for the question. As medical professionals, we should always take the time to fully educate our patients about the treatment options and help them make informed decisions about their hair loss. And that is truly not the case with some large commercial clinics. They may offer a convenient and accessible option, but it's important to understand that their primary focus is often on profits rather than patient care. And in these clinics, you may be greeted by a sales advisor rather than a medical professional, and your consultation may seem more like a sales pitch than the genuine medical evaluation. These clinics usually use a one-size-fits-all approach to hair loss treatments without considering individual differences in hair loss patterns, health histories, and personal preferences. And a few words about the doctors that work there. They are often under pressure to convert all patients for surgery, even if it may not be the best solution for the patient. And usually, once they perform the procedure, they don't follow up on the patients. In many cases, patients are not fully informed about all of their options and are misled into believing that surgery is their only option. I have personally met a lot of patients here in Scotland, in my practice, who have visited or even had surgery at large commercial clinics and were never consulted about the importance of preventing medications such as finasteride. And as we all know, that can result in a vicious cycle of continued hair loss and requiring more frequent and costly procedures to cover up the problem. All these things.
Perhaps that's one of the motivations behind commercial clinics not talking to patients about hair loss prevention, because then they can make more money out of them by having more surgery.
Unfortunately, yes, Craig. And all these things will result in rush consultations and patients undergoing procedures that may not have fully understand or agreed to.
Well,
so I believe.
Let me just stop you there,
Yeah.
and say, patients not understanding what they're letting themselves in for, because I know, Harry, in Turkey, a lot of patients have the surgery done by non-doctors, and I know that's occurring in the UK. So, Dr. Farjo, let me ask you, is it okay for skin incisions to be delegated to unlicensed, non-doctor, non-healthcare professionals?
No, definitely not. Even if the patient consents to it. But very often we know that even if the patient consents to it, the patient's probably misled into not knowing what the qualification of the person is. Now, in the UK, the law about who can make incisions tends to be, is a little bit vague. But we have certain guidance bodies, including the BAHRS, but also the CPSA, where the definite guidance is that, like you said, the skin incisions, including FUE harvesting, needs to be done either by a doctor or a qualified or a licensed healthcare professional that is connected to the practice, and the patient fully informed about what everyone does and everyone's role in the surgery. Unfortunately, in the places that we're talking about, and whether it's abroad or whether in these kind of clinics in this country, the patient very often is not in the know. And if they did, they would probably not really consent to somebody who's either not qualified, not experienced, or certainly is not trained properly in all the, not just the skills, but the consequences of making skin incisions.
Okay, well, I think that leads us nicely into, we're very fortunate to have a patient who's agreed to come and tell us about their experience. This patient would like to remain anonymous, so I'm extremely grateful for them. Welcome to this live stream. And I wonder if you could tell us a little bit about what happened to you when you went out to Turkey. Not too much about why you decided to go to Turkey, but what happened when you got out there.
Sure, thank you, and thank you for having me. Pleasure to share my experience. I won't go as you said, Dr. Williams. I won't go too much into the backstory, but I came to a decision to have a hair transplant and looked at the available options to me. I don't think anybody jumps into this lightly, you know, but there is a bewildering amount of information out there, and not being a medical person, it can be quite dazzling in a way, you know, not really sure where to go or even what you're reading. However, I settled on going to Turkey to look at or to have the hair transplant done. To be honest, the one of the deciding factors was the cost, because it looks great. You have a lovely hotel, you have the allure of a hotel transfer. I didn't have to pick any cigarettes up, I'll hasten to add, but you have a hotel transfer, and then, you know, you get met the night before. I had blood tests, although I did sort of wonder to myself, having got all the way out there, if I'd had the blood tests and blood pressure taken and they discovered that there was something amiss, what would have happened? Would I have sort of been sent back on a plane and back home? I mean, that wasn't the case, but
as a matter of interest, were you given the results of the blood tests? Do you know what blood tests they were? I mean, it's not routine in the UK to have any blood tests.
No, actually, yeah, great point. No, absolutely no idea. But I had that done, and then the following morning, I suppose the rep who I'd been dealing with came to meet me. But it is worth noting that once I'd settled on this place, the majority of our communications had been over WhatsApp, which isn't actually a particularly good medium, I'd say, for this type of medical type procedure. To the point where, you know, I was standing around trying to take pictures of the back of my head in various different angles and send them across, and they'd come back and tell me to position the mirror differently and things like that. But really importantly, I have sort of longer hair, so my requirement was just to do the crown as opposed to the whole lot. And during these WhatsApp communications, I was very, very clear with them about what I wanted, which was that. Anyway, so the following morning, I get met at the hotel, sort of walk across to the hospital, and it was a very modern, I'd say new, but very sort of modern hospital. Sort of, we go in, and I went up to the ward. And interestingly, to the point earlier made by Mr. Wallop earlier, I still hadn't met the person who was actually going to do the procedure. But the representative sort of sat me down, gave me a bunch of papers to sign and fill out, which I did. And then he said he's going to go and get the doctor. And without sounding a little bit judgy, which I'm going to sound, the doctor came in, absolutely smelling of cigarettes. And you know, call me old-fashioned, but if I'm about to undergo surgery, I don't really want my doctor to be smelling of cigarettes and things like that. But he came in and he couldn't speak any English, to your point, Dr. Williams. So it was all done through interpretation, and it was quite quick. It was rushed. I didn't really have much time to sit and be present to what was going on. I was kind of, the doctor came in, took a pen out, asked me to frown or wrinkle, raise my eyebrows, and then drew a line across where the wrinkles sort of stopped and, you know, where it goes smooth, and then proceeded to draw around the back. And I said, "What? Why are you doing that? What's going on?" And it was interpreted back. well, you know, this is where we're going to bring your hairline down to. And I was like, whoa, whoa, whoa. I've never had a hairline down that low, and probably ever since I was born, you know. I don't want that. I just want the top done. No, well, no, we can't do the top at all. You know, it makes much more sense for us just to shave your entire head off, or hair off. Sorry, not the head. And at that point, I was starting to get quite worried. You know, I was starting to think, I feel like something's been lost in translation here.
What did you decide to do?
Well, I got to the point where I was literally sitting in another room with, I think, 4 or 5 people around me with various sort of barber type implements, and I was sitting in the gown. And at that point, I just bailed out completely, and I pulled the plug, and I said, no, I cannot go ahead with this. This isn't what I was expecting. I apologize for wasting everybody's time here. But clearly there was a breakdown of communication. I did not want my head shaved at all. I just wanted the top bit. This is heading in the wrong direction. And they continue to try and persuade me by telling me it was going to make me look a lot younger, and you know, this is really the best thing for me. But at that point, no, Dr. Williams, I was out of there.
I presume then you lost all your money?
I had to fight tooth and nail. I lost the money for the flights and the hotel, and they paid back the whatever the fee was for the surgery.
Very, very briefly, I believe you went on to have a hair transplant in the UK somewhere.
I did.
Did you feel that you were dealt with differently? But just very briefly, was it a different experience?
Yes, it was. Yeah, the whole the pre-care, care during, and the aftercare was a completely different experience, and really important knowing that there are people who were within a drive away, if necessary, who I could go to if I needed some proper, you know, aftercare support was absolutely critical. Whereas going back on a flight to, well, you know, Turkey just wasn't really, you know.
But presumably you paid a lot more for that.
I did.
Okay.
I did, but it was worth it.
Well, thank you so much for sharing your experience. Very, very grateful. I hope that's useful for other people to hear. I think take-home messages: if you get out or you get anywhere, you're about to have surgery, and you don't feel comfortable, don't go ahead with it.
Yeah.
All right. Thank you so much.
Thank you.
Well, that was very interesting. Dr. D'Souza, can I ask you, are you aware of clinics in the UK where patients are asked to sign a consent allowing non-doctors to operate on them to make the skin incisions? And if you are aware of that, what do you have to say about that?
Yeah, I mean, I think black market clinics, seem to be increasing throughout the world, but also in the UK. I had a patient, it was only a few weeks ago, that came in to see me for consultation, and a very similar story, in fact, where he reported being at the clinic on the morning of his proposed surgery, in a waiting room of about 7 other men.
This is in the UK?
This is in the UK, in London, in fact. And he was approached by one of the patient advisors or sales guys to actually sign a consent, which essentially said that the FUE incision making or harvesting would be performed by one of the technicians. And he got cold feet, refused to sign, and ended up walking out. But again, I think he had a very, very brief conversation, prior to that, to booking the surgery, but only perhaps saw the operating surgeon very, very briefly, but wasn't aware of that until the morning of the surgery. And then obviously he felt that something wasn't quite right, and decided to leave.
Well, I'm sure lots of other patients actually sign that form. I don't want to put you too much on the spot, but what are your thoughts if a patient does sign that form? Is that okay? Is that ethical? They know what they're getting themselves in for. I mean, foolish in my opinion, but if you sign a piece of paper that says you're happy for a non-doctor to operate on you, is that okay?
Yeah, I think it's a really difficult position which patients are put in, because obviously they're there on the morning of surgery. I imagine they've already paid for the surgery, they've taken the time off work, etc. And I think it would be very easy for unethical clinics to put it across in a way saying, well, this technician is very experienced, they're incredibly good at doing it, etc., etc. And I can imagine a lot of patients don't really question it, but no, it's certainly wrong. And as previously mentioned, it's against the BAHRS guidance. It's against ISHRS guidance, and that's something we're very, very clear about.
Okay, well, that brings us to a point where I think I'm going to ask our second patient to come in. Our second patient did go to Turkey and did have surgery. I suspect with incisions being done by non-doctors. But thank you so much, patient 2, for joining us, again, anonymously at their request. Can you tell us a little bit about, again, not so much about why you went to Turkey, but about your experience there? You did have surgery and how you felt about the result.
Yeah, thanks for having me on. I haven't overly prepared what I was going to say, so I'm winging this a little bit, if you'll bear with me. So I went to Turkey in 2018. There was, from what I've heard, perhaps a bit more in terms of build-up. So it wasn't a snap decision. I've been thinking about it for a few years. I had a consultation they had a clinic on Harley Street that says we have our UK base here and we work with a hospital in Turkey and you have your photos done and taken here. So I'd done all my stuff in the UK and they'd done their recommendations. I think I then put it on pause for a year after that and thought I'll have a think about it. And I carried on doing my research and nothing bad showed up, and they were still there a year later operating. So I went back after that, and yep, it was all arranged for me to go out to Turkey.
So you went out. You had your surgery there. Do you know if the which bits were done by a doctor, which bits were not done by a doctor?
You tested my memory. To be honest, I don't think it's necessarily something I paid a lot of attention to. Okay. I wasn't particularly aware that, the doctor should be doing this bit and technicians can be doing that bit. And I just sort of went with the flow.
So you were pretty happy with how things went out there? Yeah,
I mean, there was no red flags for me.
Great.
Whilst I was there, I wasn't in a room with loads of other people.
So tell me a little about your result and how you felt about your result. Were you happy with, it takes a while for the transplant to grow out. After about a year and a half, were you happy with what you got?
Well, I wasn't especially unhappy. There was some hair in the recipient areas and it was growing. It wasn't particularly thick. And I had my hair kind of long, so it sort of masked a lot of it. It wasn't until the pandemic hit and all the barbers were shut that I decided to shave my head because I couldn't get a haircut. And it wasn't until that point that I really realized, hang on, you can see such a stark difference between my normal hair and the hair that had been transplanted, and also the donor hair. There was a big obvious rectangle on the back of my head where they'd taken from.
And did you feel, so at that point, did you feel psychologically that you had benefited from the transplant that you had in Turkey? And did you feel you needed to have something else done to make your transplant more natural?
Well, it was at that point that I'd realized I hadn't been given what I was promised. Up until then, it was sort of being masked. I hadn't paid a lot of attention to it. They were still saying sort of wait, give it a bit of time to grow a bit more. And then it was actually seeing it like that I realized that, hang on, this hasn't worked as well as it should have done. And this isn't what I was promised.
Did you feel maybe, well, can I ask, if you don't mind saying, do you remember how much you paid for your transplant? Or rather, do you feel you got value for money? Do you think you got value for money?
Well, knowing how much it costs in the UK, you get what you pay for, I think. I had some transplanted hair. I paid $2,500 just for the surgery. So I paid for my own flights and hotel and stuff on top of that. So I'm aware that it can be done cheaper. So I didn't pick one of the cheaper options. But really, it's not about the money. It's about what I was told I was getting and what I didn't get. And also the donor hair that they've taken. And
so did you feel that you'd been deceived?
Yeah, 100%.
Okay. All right. Well, thank you so much for sharing that journey with us. Really, really grateful. I think. Is there a sort of a take-home message you'd like to give patients who are thinking about having hair transplant surgery, either in the UK or abroad? Is there sort of a one-line message you'd like to give them?
In a word, no, because the message I would give is not advice that I would have taken. My advice would be don't have a hair transplant abroad in Turkey. But I'd heard that advice, but I thought I'd done my research. So my actual advice would be, if you're not happy, walk out and leave. Again, that's not something that would have helped me. So my final real bit of advice is pay on a credit card. So if it goes wrong, you can sue them. Right. And it was the credit card company that paid for my repair operation. So that's the take-home message. The only practical advice that I think people would actually take away and listen to.
Thank you so much for joining us. Really grateful.
Thank you for having me.
So Harry, on that sort of note, as a member of the public, what would you expect from the doctor and the clinic? This is specifically in the UK now, not abroad, but in the UK, in terms of ethics, what would you expect as a member of the public, as a patient?
Well, I mean, interesting listening to patient one, where my experience was very, very similar, where the doctor themselves didn't put me under pressure. I was just another person. In fact, one admitted he was doing 45 operations that day. And when I asked him,
45?
Yeah, he was doing 45 hair transplants that day. And I said, oh, does that mean that you won't be doing me? And he said, no, of course not. I'll just be overseeing it. I can't possibly do, everyone personally. And he thought it was a crazy thing that I should be asking that. But I wasn't put up. When I then backed out, the doctor seemed quite relaxed. That's okay. Of course, if you're not happy, of course you can. But it was then the patient coordinator and the salesperson who then got in touch with me by phone, put me under huge pressure. And if I was, I had no intention of ever going ahead. But if I was wavering, I would have really felt under huge pressure to go back the next day. And of course, this was to answer your question. The coordinators were salespeople on commission. So I think that's the first thing is I would ask in the UK, is anyone getting commission for me agreeing to go ahead with this operation?
Yeah.
And also I would want to
that's a very good point.
I would want to meet the doctor. If you're going abroad, you're obviously not meeting the doctor, but maybe the very, very good ones do telephone consultations. That was never even in the same ballpark. So I want to meet the doctor. Can they give me some of their time to discuss what my needs are before we even discuss whether a hair transplant is right for me? So,
okay,
can you spare me 20 minutes time to have a chat?
I think that message about meet the doctor, know what's going on, is really important. And Dr. Farjo, why are people going to Turkey so much? Why is it such a thing? Can you tell us a little bit about the advertising of hair transplant surgery, particularly in the UK?
Yeah, I will. But just before I get to that and listening to the patients and all that, and the advertising comes into it, the problem is that all this, including the way people advertise, and I'll come to it, is really putting hair transplants or dressing it up as a commodity that you could go to the shop and buy one. Whereas what we here in this room think about it, these are patients who have a condition that's caused hair loss, and it's our job to figure out why they're losing their hair and what they can do about it, and maybe suggest some treatments. We're not saying, how much is that hair transplant for? And this is the danger. What most people don't realize is they're thinking, I can just go and buy the cheapest one or the one that looks the best, not look for a doctor who can tell me what's going on here and what can I do about it. So, if I go on Instagram or internet now and like I think Harry suggested, you pick hair transplant, I'm instantly bombarded by sponsored messages. Yes, sadly, mainly from Turkey, but I think other countries are catching up, and even here in the UK, we're getting a lot of people buying AdWords that targets other clinics. And now the latest thing, which is concerning, is, and it is mainly black market in Turkey, targeting football clubs. And they're doing sponsorship, shirt sponsorship, perimeter advertising. And sadly, there's only room to say, you know, come to Turkey for a hair transplant. And it all cheapens it up, makes it look like a commodity, and makes it sound like an exotic thing. I can just go and buy one. And then, you know, yeah, and sometimes you're going to get a fantastic hair transplant, but sometimes you're not. And you can get a bad transplant, a good transplant anywhere. But the point is, if you go somewhere where there's a professional looking after you, then they can sort it out, or they can suggest means where you could get what you want out of it. And in those advertising words, there are words like, you know, we'll give you unlimited graft numbers, whatever that means, or everybody gets 3,000, 3,000 and 4,000 grafts, or like Harry said, you know, you need 7,000 grafts just like that, and then seeing his picture, oh well, maybe you need 5,000. And for us, these are like fantasy figures. That just nobody does that.
Or as Harry said, you know, you get told it's painless or scarless, or
things,
you know, no incisions, all this sort of stuff. Well, Dr. D'Souza, can I just ask you, just very briefly, just in a couple of words, what can go wrong with a hair transplant? How would you divide up the categories of what can go wrong?
I mean, I suppose it all starts really with patient expectation, and you know, I think good ethical surgeons are always very focused on that. You know, setting realistic expectations from the beginning and realizing that there's only so much donor to go round. So you know, a low hairline is not always better. You know, and the density that you can achieve has to be done in a way where it's going to look aesthetically good. So, you know, naturalness, I guess, is probably one of the most important, if not the most important aspect, I think, of hair restoration surgery. But there's certainly no guarantees, even if it's performed, you know, flawlessly from the surgeon's point of view. And the, you know, there's a lot of moving parts involved. You know, the technical staff and the surgical assistants have got a vital role to play. And there's so much that goes into it that, you know, you have to do your homework properly to have at least a good starting chance of getting a good result.
Sure. And I think, you know, for patients who are listening here, you know, you can have problems in the donor area with scarring or over harvesting and infections. You can have problems in the recipient area with poor density, poor design of the hairline, not looking natural with the rest of the hair loss, poor angulation direction of the hairs. So let me ask you, Dr. Banaros, a lot of patients with hair loss are psychologically vulnerable. A lot of people don't have big budgets. What would your advice be to patients who have limited budgets and are considering a cheap clinic in the UK, or even going to a health tourism destination? What would you say if you don't have much money but you want a hair transplant?
Well, I would start by saying that hair transplants have become much more common nowadays, but so has corrective surgery, Greg. And I believe that the reason is that you get what you pay for. So finding the right surgeon and the right clinic is by far the most important decision for anyone considering a hair transplant. The procedure is complex and should only be performed under proper surgical conditions with high standards of hygiene and surgical equipment. And this doesn't always happen. Sorry about that. With cheap hair transplant clinics, you know, they employ less experienced or non-qualified practitioners. They have different levels of hygiene or equipment, and that can put patients at risk for infection, folliculitis, or any other complications. So my advice would be to find an experienced hair transplant surgeon who is a member of the ISHRS or the BAHRS and schedule a consultation. That's my advice.
I think that's great advice. I think we're gonna come to an end, but just for some closing comments, Harry, what would you say as a well-informed member of the public on the role that the media has to play in all of this? You know, there's a lot of sensationalism. You know, I get asked all the time to provide case studies, but they want a bad story. They don't want a good story. Now, hair transplant surgery is a fantastic procedure when done well, in the right indication, the right patient. But what do you think the role of the media is in this going forward, and how can we help to educate patients?
Yeah, I mean, that's a good point. And I am part of the problem, and the people I work for are part of the problem. I got called up only the other day to see if I could track down families of all the people who died from medical tourism. It's like, well, I'm not sure they really want to talk to the media. So, yeah, I mean, hair transplant, I do know people, friends, colleagues who have had successful hair transplants, and it's just transformative. You know, it really has made them so much happier. But they spend money. But it's not necessarily about spending money. It's about doing your homework. And yeah, the media should do. Unfortunately, things are changing. I think things are changing. I think surgery is now becoming more normalized. It's less of a taboo. So I think, you know, guides to how to have a successful hair transplant. I think there is more appetite from editors and newspaper kind of owners and magazines to maybe run those sorts of stories in a way that, you know, the simple, you know, shock headline, my life was ruined by a bad transplant, you know, those do get lots of clicks, sadly. But no, good guides and advice should do just as well, because there's a lot of appetite for it, as you know, as proved by this evening.
I think you're right. I think it's not just the media; it's also social media. You know, influencers have a big role to play. The modern ways of communicating. So I'm going to wrap it up now and say thank you so much to all our faculty for taking their time to join us and to give their thoughts. This live stream has been recorded, so for anybody watching who'd like to watch it again, or you'd like to tell people about it, if you go to the website fightthefight.ishrs.org and look under the events tab, that's where you'll find it. Good night, everybody, and thanks for joining us.
Thank you. Good night, everyone.
Bye.